Alright, ladies and gentlemen, it's Dr.SammyG in the house. I'm back, baby. I am back. So today's topic is signs you may have diabetes. What are the major signs that may indicate that you have diabetes? So we're going to go through the typical symptoms that you might be dealing with that can indicate they have diabetes. And I made a list of 5 major symptoms that you should take into account if you may have diabetes. So what are the major signs? Number 1, you are tired 24/7. You're fatigued. You don't have energy to do shit. You have no motivation to do anything. And the reason for that is because your organs need glucose to produce energy. And when you have diabetes, you have a high level of blood sugars. However, due to lack of insulin and insulin resistance, the sugar is not able to enter the organs. When the cells are deprived of glucose, that means the cells cannot produce energy, and thereby the organs cannot function properly. Consequently, you're getting tired, you're not able to do the work, you're not able to concentrate, and you're not motivated, and you have no energy. Due to the fact that you have high level of blood sugar that is not entering the organs, and thereby depriving the cells of using glucose to create energy and make the organs function properly. So number 1, you're fatigued and no energy. Number 2, what is number 2? Number 2 is polyuria. Well, polyuria means that you have an increase in excessive concentration of glucose in urine. And when you have an increased concentration of glucose in urine, that means you're going to have an osmotic effect, meaning that the body and the organs will lose some water, causing you to be dehydrated. And all that water will go to the urine to compensate for the high concentration of sugar in urine. And that means you're going to have a frequent urination, in other words, polyuria. In other words, you pee a lot. You're peeing 24/7. So that was number 2. Number 3, you are thirsty. You have an increased level of thirst. Now, some of you guys are watching right now might be thirsty when you see me. You might be thirsty due to the fact you're seeing a handsome man who is intelligent and is well-spoken and articulate. However, you may not be thirsty because of that reason. It could be the fact you have diabetes. All right? And why is that? Well, here's the thing. Like I said before, when you have an increased concentration of glucose in urine, it causes the body, due to the osmotic effect, to lose water in the organs and in the cells, causing dehydration, and thereby most of the water is losing in the urine, and hence you become thirsty. So that's why you drink a lot. You drink a lot of water and you become thirsty, and you're wondering, what is the main reason you become thirsty? Except for watching Dr.SammyG. So that's number 3. You are thirsty 24/7. Number 4. What is number 4? You have an increased itchiness around the genital area. What happens is that when you have, once again, a high level of concentration of glucose in urine, it actually can cause a dehydration around the skin. And also the pH level is decreasing, causing a more acidic environment. And a lower pH level is susceptible for candida to grow, causing fungi infection, and hence around the genital area. And for women, you have something called candida vaginitis. And the candida vaginitis is a candida infection around the genital area due to the fact that in this case, when you have diabetes, you have a high concentration of sugar or glucose in the urine, causing a more acidic environment, and also the dehydration, which make you have an increased itchiness around the genital area, and thereby causing a genital infection, in this case, a candida infection. In other words, candida vaginitis. Well, that's the first thing. For men, you have something called balanitis, and it's pretty much the same reason here. When you have an increased concentration of glucose in the urine, you're losing water, becomes dehydrated, and the skin becomes dehydrated, which makes it more susceptible to infections. In this case, balanitis, which is due to a candida infections most of the times around the genital skin, causing itchiness, and thereby a fungi infection. Now that was number 4. What is number 5? Number 5 is blurred vision. Your vision is getting worse. You don't see as optimal as you did once upon a time. And there is a specific reason. Now, usually that blurred vision is just a temporary symptom, and it goes away usually after the blood sugar level has been normalized. But the main reason for that is because you have an increased glucose concentration in the lens in the eye. So what is the lens? Well, the lens is the part of the eye that is behind the iris. So what does the lens do? What does the lens do, ladies and gentlemen? Well, what the lens does is pretty much it adjusts the shape so that when the light enters the eye, the lens adjusts the shape so that the light enters the retina so that you can create some sharp images, and hence you're able to see. Now, so when you have diabetes, what happens is that you have an increased concentration of sugar in the lens. And when you have an increased concentration of sugar in the lens, or glucose, it has an osmotic effect as well. What happens is that water enters the lens and it becomes more swollen due to different physiological processes. And as it becomes swollen, it's not able to adjust its size and it cannot bend. It becomes very, I would say, stiff. It becomes very stiff, yeah? And as it becomes stiff, it's not able to adjust its shape. And when the light enters the eye and through the lens, so that it should enter the retina, it's not able to adjust its shape due to its swollen size. And hence, you have a blurred vision. This is usually temporary because when you are able to normalize the blood sugar levels, the blurred vision will go away because the concentration of glucose in the lens will also be reduced. So, ladies and gentlemen, these are the 5 major signs that you may have diabetes. And if you have these major signs, make sure to come to the family doctor. We can take some blood sugar test and also take a HbA1c test to measure the level of glucose for the past 3 months to get a better understanding of your blood sugar levels. So that's it, ladies and gentlemen. This was Dr. Sammy G. I hope you guys have a great day, and I'll be back with a new video. Peace out.